Hello, hello, back again. DangTeach at CCSD. Let's get into it. Okay, once again, we're gonna hit community pharmacy, retail pharmacy, part two. So if you haven't seen part one, go ahead and rewind, watch that, and come back to this one. All right, prepping the prescription. So we use the triple check system. You're gonna check the label when you pull the med. You're going to check it when you prep the prescription, and you're going to check it a third time when you put it back on the shelf. So in medicine or in the medical field, the third check is when right before you administer it to the patient. So check the NDC number, it will be on the label, match it up with the 10 digits on the bottle, and you're guaranteed to have the correct drug. We count by fives in pharmacy, just makes it a lot easier and quicker to count by fives. And then put any extra back in the stock bottle, close the cap, and then you'll fill the patient's take-home bottle. Right? And then you'll need to stage it for the pharmacist. So here's the stock bottle, and then you'll align this right next to it with the hard copy. So you'll need all three for the pharmacist to check. So the Poison Prevention Act 1970 requires all drugs in a safety cap, so a child-proof safety cap. However, there are some exemptions like nitroglycerin. So if you're having a heart attack, we don't want you to be messing around with a safety cap. A lot of robotics are used, so they can actually fill tablets and capsules, count the correct amount, label the vials, and even close the cap with the correct cap. So that's good for fast movers. So they're usually stored a little bit different from the rest of the stock as well. And then you got to stage everything for the pharmacist to second check. Now if the pharmacist fills, then a technician can second check the pharmacist. Apply the additional labels. So the warning labels, extra directions, they're called auxiliary labels. The pharmacist will let you know which ones to put on. And a lot of order entry system will actually pre-print the auxiliary labels for you. So the check, the second check. So addition, if this is a brand new script, you're going to need a second label. So one label goes on the bottle that goes home with the patient. The second label, a duplicate of what goes home with the patient, goes on the reverse side of the hard copy. And the pharmacist will check what the doctor written versus what you have transcribed, check the drug you pulled, and then they'll initial the second label and affix it to the back side of the original copy. So when it's filed, we'll know who was the pharmacist on duty, who was the tech on duty, and we file these prescriptions by the RX number. Patient pickup log. So you can only expose that you can only expose that next field to write in name and signature. You can't have it open like this because then you can see everyone who previously came. So there'll usually be a cover slip and only expose the next signature. For CMS, they want to make sure you're in compliance. One thing you'll need to document is the counseling. So if patient refused counseling, make sure you document that. And a good place to do that is right on the pickup log. Did you offer counseling? Yes. Did they reject it? Yes. For controlled substances, you're going to have to put a red C 1 inch down from the right hand side of the original prescription. For C2s, they need to be filed separately from all other prescriptions. And most people will throw in C3 through 5 as well. Cash register. So if this is linked with inventory, then make sure you try to keep an accurate as possible inventory. OTC meds, they do not require prescription as long as there's adequate directions on there. So it has to be printed on there somehow, and if the patient follows those manufacturer's directions, it should be safe. Right? So for common drugs that used to be prescription only and they're found to be safe, they'll most likely be turned into OTC. So an example was Claritin. Claritin for allergies. The generic is loratadine. Now you can get it readily available for seasonal allergies. Behind the counter still does not require a prescription. However, for safety reasons, you may have to answer just a couple questions from the pharmacist or the pharmacy technician. Sudafed. Pseudoephedrine containing products will require just the signature lock, and this is for diversion into meth production. A Plan B, since 2015, it's pretty much over the counter now. Some places will still have it behind the counter. If you're a diabetic patient and you're out of insulin, you may need insulin before you can get an appointment or get a new prescription from your doctor. So just show them proof, and they should be able to dispense you some insulin. And then in some places, dextromethorphan is held behind the counter. Other things you might find in the pharmacy are durable medical equipment, DMEs, and there will also be stores or pharmacies that just deal with durable medical equipment. So if there's a prescription written for a DME, then most likely that's medical justification for the insurance company to pay for it. Ordering and receiving. Usually that's going to be everyone's task. You'll probably have one pharmacy buyer or one pharmacy purchaser that's kind of in charge of it overall, but everyone's responsible for it. So if you find something that's low in stock, put it in the want book or just put it in the order form. A lot of these order systems are now just online, so everyone has access to the website. They can look for the item, put it in the list, and then it's the purchaser or buyer who will actually approve it and then submit it to the vendor. Anyone can receive. Some places require only the pharmacist to check in controlled substances, but a technician can. But make sure you check every packaging, every bottle, every piece of glass. Make sure it's all there and not damaged before you sign for it. The vendor will also supply stickering for the pricing and the scanner for your system. So that's one easy way for ordering. So if it's your last bottle of something, just pull that sticker off and then just stick it in the want book. Makes it really easy. Other services provided, disease management. So one item is coagulant therapy. So a lot of places will have clinical services. So instead of going into a hospital where they're super busy once or twice a week, you can go to your nearby pharmacy down the street, get your blood work done, and you're off and running. So it makes it a lot more convenient. Diabetic asthma clinic management, also weight loss. They can have that there. Clinicals, more and more are popping up, these minute clinics and these full services. They'll have usually a nurse practitioner or a PA that will be there. Very convenient. An example would be for sports physicals. So if your child needs a sports physical, you can just go down the street to the pharmacy, get them checked out instead of making an appointment, going to the doctor, taking time out of your work schedule and their school schedule. And then vaccines, flu season, any other vaccines, as long as they are reviewed by the nurse practitioner or physician's assistant, sign the consent, then they can get vaccines. Some places, the pharmacist can write prescriptions and administer vaccines as well. Definitions. NDC. So it's a 10-digit unique national drug code. So the first set of digits give you the manufacturer. The second set gives you the drug product. And lastly, the third set gives you the package size. DXM, or in the case of Robitussin DM, that's going to be dextromethorphan. That is an antitussive, a cough suppressant, and it's abused when it's taken in high doses. NSC, aka an easy cap, in this case non-safety cap. So some drugs are exempt, such as nitroglycerin for angina. POS, that is your points of sales, point of service device. So usually your cash register, sometimes your tablet or your scanner. DMEs, those are your canes, IV pools, wheelchairs, hospital beds, durable medical equipment. COPD, so you're probably more familiar with asthma. COPD is different, so don't mix or interchange those drugs. COPD is chronic obstructive pulmonary disease. What are purposes of signature logs? So remember, with signature logs, you're going to have to cover up the previous signatures. That way you don't violate HIPAA. But for CMS, it's to make sure you offer counseling, you do what you need to do. Right? So audit requirements, proof of registration. So there might be like the HIPAA acknowledgement signature, if they signed it or not, on there as well. How are hard copies for controlled substances filed? So for C2s, if you guys recall, they need to be separate. You got to keep those for 2 years for your audit. And for the original hard copy, you got to put a red C 1 inch from the upper right hand side. All right. Very nice. That concludes retail pharmacy, aka community pharmacy. Once again, thank you for joining me, and it looks like all I have left to load are the chapters for, or the presentations for, hospital pharmacy, and then I'm done with phase 1 of education 4.0. Phase 2, I'll be loading the assignments, but before I do that, I do have a special announcement for you guys, so stay tuned for that. I'll probably schedule a live session.